Good afternoon, everyone. It is my pleasure to welcome you all to the add-on program on tobacco control and cessation. I have a note to make before commencement of the program. I would like to request all the attendees to kindly mute their mic. Thank you. This program is for motivating the dental healthcare professionals for awareness about the hazardous effect of tobacco consumption to their patients and help them overcome the habit of tobacco intake through proper counseling and management by making it an integral part of their general dentistry in a regular dental setup. As the mortality rate is increasing worldwide due to tobacco use, it is our responsibility to help educate the people for better future in the area of healthcare. It is the small things that we do on a consistent basis that add up to the big, beautiful results. Now, I would like to welcome Dr. Sunira Chandra ma'am, Professor and Head of Department of Oral Medicine and Radiology, to enlighten us about this program. Over to you, ma'am.
Thank you, Bhavya. Warm greetings from the Department of Oral Medicine and Radiology. Tobacco is highly addictive. By the year 2030, tobacco is expected to be the single biggest cause of death worldwide. Every year, more than 8 million people die from tobacco use. Half of these deaths occur in people between 35 to 69 years of age, who lose an average of 20 to 25 years of their lives. These statistics provide a compelling case for a concerted effort by organized dentistry and individual dentists to help reduce tobacco consumption. The dentist plays a critical and proactive role in helping people to quit smoking or use of tobacco in its myriad forms. His advice to quit can increase cessation rates by as much as 30%. The dental setup provides an excellent venue for offering tobacco intervention services. This is because patients are known to be particularly receptive to health messages and visuals at the doctor's chamber. Due to the significant role played by dentists in treating tobacco use and dependence, the identification, documentation, and treatment of every tobacco user they see needs to become a routine practice in every dental office and clinic. In other words, tobacco intervention should be included in general dentistry and must be viewed as an integral part of quality dental care and not just a charitable work. Thus, this add-on program is organized that offers a compendium of useful information about tobacco, its addiction, and management. With this, I would like to welcome respected Chairperson, Saraswati Group of Institution, Mrs. Madhu Mathur ma'am, President, Saraswati Group of Institution, Dr. Rajat Mathur sir, Director Finance, Saraswati Group of Institution, Mr. Charit Mathur sir, Director SHRC and Biren Shankar Mathur School of Nursing, Mrs. Smita Mathur ma'am, Director HRD and Marketing, Mrs. Ritu Mathur ma'am, Principal SDC, Dr. K.N. Dubis sir, Head of all the departments, faculty members, postgraduates, interns, and dental students. I welcome you all. Over to you, Bhavya.
Thank you, ma'am, for this exquisite introduction of this program. Now, I would like to request Dr. Siddharth Kumar Singh, sir, Professor of Department of Oral Medicine and Radiology, to introduce Speaker of the Day. Over to you, sir.
Thank you, Dr. Bhavya, and a very good afternoon to everyone. I would like to introduce Dr. Puneet Gupta, the speaker for today's lecture. Dr. Puneet has completed his BDS from Manipal Academy of Higher Education. Thereafter, he did MDS in Public Health from RGUHS, Bangalore in 2008. Presently, he is working as an associate professor at the Government College of Dentistry, Indore. He is the executive committee member of Oral Health Working Group of World Federation of Public Health Associations. He is also EC member of Indian Association of Public Health Dentists. He is an advisor to Medical Students Association of India too. He has published a systematic review for the oral health group of the Cochrane collaboration. He is also a member of Cochrane Knowledge Translation Workshop Group. He has about a dozen publications listed in PubMed. His passion to teach has driven him to conduct courses in India and abroad. His areas of focus are research, tobacco control, etc. So looking forward to your talk, Dr. Puneet. I'm sure we all will be benefiting from today's lecture. Over to you, Dr. Bhavya.
Thank you so much, Siddharth sir. Now I would like to welcome Dr. Puneet Gupta sir, Reader, Department of Public Health and Dentistry, Government College of Dentistry, Indore. Over to you, sir.
Thank you, Dr. Bhavya, and thank you, Dr. Siddharth, for the introduction. And before I start, let me thank the management committee of Saraswati Dental College, Lucknow, for organizing this webinar series, and also the principal of Saraswati Dental College, Dr. K.N. Dubis, sir, for providing an opportunity for us to present our knowledge about this topic and share it with mainly the interns. And also thanks to Department of Oral Medicine, Dr. Sunira, for inviting me to deliver the first of the talk of the series. And basically, as you all know, I am a public health dentist, and I will be trying to give you an overview of things related to tobacco pandemic. So tobacco itself is a very, very, very vast area. There are different aspects. So, and I know there are really good speakers who will be taking the sessions in the next 10 days, and they'll go in depth into each aspect of tobacco control and how tobacco pandemic affects us. But I'll try to give you an overview of how things have been, and tell you basically what are the areas in which you can think when you think about tobacco control. Okay, so pandemic, quarantine, all these terms are mentioned in the PSM book by K. Park, but these books have come in very common language recently in the last 2 years when COVID-19 struck us. So we know all these terms like pandemic, quarantine, but these terms have been with us during our UG days. So what is a pandemic? Pandemic is basically a global epidemic, and we know that presently COVID-19 has been declared as a pandemic, and it's spread all over the world, right? So what happens is when something spreads all over the world, the countries, the head of the countries have to come together to tackle the problem, and there have been lots of death even due to the COVID situation. So these are shown in the diagram. And now the thing is, when we talk about deaths, so the number of deaths would be more in India. But when we represent it as number of deaths per thousand population or per 1 lakh of a population, so we see that India is not doing as bad as a few other countries with respect to COVID. So similarly, why is tobacco a pandemic? Because there have these which have shown the effect of tobacco, but one of the main is the Tobacco Atlas, which shows that the percentage of death which can be attributed to the use of tobacco all over the world is quite significant. And we see that China has a very substantial attribution of death to tobacco, right? So tobacco causing death in all over the world. Some places it's very high as 25%, and more caused due to tobacco, but a few places. But the other thing to consider is in a lot of places where these percentages are less, also have a very less population, right? So we see a lot of Africa and Middle East where we see less deaths due to tobacco, probably due to the strict enforcement of laws. Now let's see, let's have an overview, seeing how things have developed over the last so many years. So before we start, we say tobacco pandemic, but what is tobacco? So there's a plant called Nicotina tabacum. It's a plant which originated in the Americas. That plant gives us tobacco leaves. It's a non-food crop. It's a non-food crop, and the leaf, when the matures, the leaves from these plants are collected and they are processed for use. So the tobacco plant. Now, how is it? How do we process the leaf? So the once the tobacco leaves are collected, so there that leaves there are different ways of curing the leaves. So first is sun, like the leaves are just kept in the sun. So what is curing is basically heating it in such a way that the moisture goes away. So what happens when the moisture goes away is the tobacco leaves, they contain around 90% of water and they are very high in nitrogen. So when the moisture goes away, the chemicals get concentrated, and the main chemical is nicotine. So the one of the methods is just to put it in the sun. With the sun rays, the leaves will cure. The other is air. Air means the leaves are put in an open hut type of a thing, so that air is flowing and the leaves are drying, but it's not under direct sunlight. The third method is fire. So basically what they do is they burn some sort of fire below, and on the top of that they put the tobacco leaves. So the leaves dry due to the heat from the fire. But all these three methods were used initially in the past, and they give the tobacco leaves which are darker in shade, and they are not well accepted when it comes to using by the tobacco industry. So they started what is known as flue curing, in which what happens is the tobacco leaves are arranged in racks, and flue means it's like a hot air. It's the exhaust from a certain heating process. So what happens is that only the hot air blows through the system and dries the leaf. So in that, what happens is if you put it in direct fire, so sometimes the fire ash and all that gets stuck. You get very light colored cured leaves of tobacco, which have a greater acceptance in use for using it in different tobacco products. So that's about curing. But what happened is how did the tobacco plant and tobacco leaves come into existence? So up to 6000 BC, there have been reports of cultivation of tobacco, but this cultivation was very much limited only to the Americas, that's the North America and South America. So somehow this plant out of evolution came in this land, and at that time it was not there was not much travel, so the main cultivation was restricted to Americas during the 6000 BCs. The first report is in 1942, when Columbus reaches America, and then he was given the dried leaves of tobacco as a gift. So tobacco was used as for religious purposes or for gifting purposes. So the Columbus, when he came, he got this as a gift. It was dried leaves which had a very typical smell. So that attracted him towards that. In the 1400 years, and this would be 1500s. So 1500 AD, the tobacco reaches Europe. It reaches the Europe because of this trade and gifting and all that. So this is how it spread. So what happens is, we all know that Portugal was they were traveling a lot and they were traders, and a lot of European countries were traders. So, and even the British, they were spreading their empire and they were traveling to different places and finding new land and all that, right? So that was the area. Once the tobacco reached Europe, from there it spread to a lot of the parts of the world. And this one of the depictions from 2004 data shows that India, China, and definitely the Americas, they are the major producers of tobacco crop. Tobacco is basically a very tropical uh, plant. It loves a hot and humid weather. So you will find these countries which are closer to the equator. From there, we get a lot of tobacco cultivation. And even Australia is contributing quite a good amount of tobacco agriculture crop to the world. So this shows that how initially it started from the Americas, but today tobacco crop has spread all over the world. This is the agricultural aspect of tobacco as a plant. Now, if this plant was not useful, nobody would have cultivated it, right? Nobody would have propagated it. So what are the uses or what are the possible benefits of a tobacco plant? So it was used for religious purposes. It was used to as an probably as an analgesic when there was pain or to elevate the mood. All these things, because that's something like it was given as a gift to some people. It was used by kings. It was a sign of high society living and all that. How were things? So around 1571, the European doctors, they reported the use of tobacco to curing certain diseases. Later, around 1776, the tobacco was being used in wars, because what happens is the soldiers are sent to the war front where they have a lot of stress, right? So the as a backup from the country, they used to give them ration. So in the ration, they also had a certain amount of tobacco, which was given probably because tobacco relieves anxiety. They are more attentive. It increases their alertness, or probably because it also suppresses the hunger at times, right? So looking into all these things, they had found uses of tobacco. They had found uses of tobacco, and tobacco was being used in war. And then in 1847, Philip Morris in UK, he started manufacturing cigarettes. He came up with the use of cigarettes, and then it started being used heavily among the population. Now, what is there in the tobacco plant or the tobacco leaf? The tobacco leaves, basically, as I said, it requires a lot of nitrogen from the soil, and it produces a chemical known as nicotine. Now, nicotine is very similar to acetyl choline, right? So it can bind to the acetyl choline receptors, and that is probably gives us the mechanism of action, why it can increase your alertness or why it can suppress hunger. But the main problem of nicotine has been that it causes addiction, right? So with the nicotine, people get addicted, and then when we try to stop using tobacco, we get various type of symptoms. So that's one of the issues. Now, we also know that tobacco was being used, and it was and this is Devanand and his favorite song, मैं जिंदगी का साथ भाता चला गया और हर फिक्र को धुएं में उड़ाता चला गया. In that time, in the movie, very frankly, the use of cigarette was shown. Then the second thing is they were hero. He's not right. So it was shown that even a hero is using cigarette. It's a norm. It's just because it's his style, because he was the fashion icon of his time, right? So he used a cigarette on screen, and everyone said that he's just trying to relieve his stress with this cigarette. This was a very common, and like I hope a lot of people seeing this started smoking and all those things happened, right? This was a norm. Tobacco use was a certain point of time in the 1900s, definitely, if you ask people, they'll say that yes, there's nothing harm. It's a fad tradition. It's a society culture that we are gifting tobacco to somebody, and all these things are happening. I also found an interesting article towards the end of 1900, around 1990, somewhere this article was published, beneficial effects of nicotine and cigarette smoking, the real, the possible, and the spurious. So what they say, but the good part is this article begins with that cigarette smoking is an established risk for cancer and cardiovascular disease and is the leading cause of unavoidable disease in most industrial countries. Less well known possible beneficial effects which are briefly considered in this survey. So they found that with Parkinson's disease or for weight loss or for some other diseases, the tobacco is useful and smoking has beneficial effects. Right. So very frankly, you should start with tobacco causes cancer, right? Because they say tobacco may cause cancer, right? So you also have to look at the other side of the coin, which generally we ignore every time. You also have to understand that yes, if somebody is consuming tobacco, why is he consuming? There are some uses or something related that they are using that. So you have to consider this before proceeding further. But in the 1900s, a lot of information also came about the harms of tobacco use, right? So just in around 1912, the first report on smoking and its relation to lung cancer was had come. So because it was being used around 1600, so past 300 years, people were observing. They did not have very good epidemic methods and other tools to establish and give some final say, but they published a report. However, in 1967, the Surgeon General's report came and which very clearly established that smoking causes lung cancer. So in this report, it was very clearly evident that yes, there are harms of smoking, and lung cancer is a serious disease. It causes a lot of death. So it has to be considered, and we should try to quit smoking and try to reduce tobacco use. And then the concept of tobacco control started growing, right? Because see, if it's good, but and it has some harmful effects, but the harmful effects are not very much, so we would still use those things. But if the harmful effect is such that it can cause you the it can cause lead to death, then definitely you'll think that okay, smoking cigarette can relieve stress for me for some time, but there are chances to that, right? So that somehow if when we take patients for behavioral counseling, we have to somehow understand and try to make them understand that yes, okay, whatever is there, but you have to measure both sides, right? If you are smoking cigarettes, that's okay, but what it can lead to, and if you die, how is it going to affect your family and all these things. And towards the end of 1900, again, what happened was Bennett Lebo, who was the CEO of a tobacco company, he admitted that tobacco causes cancer because so far the tobacco industry had a lot of money and they were fighting with the government that don't ban tobacco and will not show warning signs and all that. But somehow at the end, even from the industry, somebody came out and said that it is harmful. So what are the basic of using tobacco? So it has been depicted by a lot of agencies, the WHO and everybody have given their own as evidence based. There's a lot of literature behind each of the things, but it affects your eyes, your brain, your hair, your nose, teeth, your mouth and throat, your ears, lungs, heart, liver, male reproduction, female reproduction, urinary system, hand, skin, skeletal system, delays wound healing and surgery, and leg and feet, circulatory system, and even the immune system. So it has a lot of effects all over the body. And definitely, I think Dr. Deepika would be talking in depth about the harmful effects of tobacco in the oral cavity on the teeth. So because we are dentists, we it's our responsibility to cite it at the earliest and refer the patient for a quick treatment, because the earlier the treatment, the better the prospects will be and the better the chances of survival are. So a lot of it the oral cavity, so it's very important. Also a lot of reports came on benefits of quitting. So in the sense, benefits of quitting means how your heart and how your health and everything will improve once you quit. So these things now started being noticed. So this raised a concern about the tobacco control. So there have been, it's not that only around 2000 tobacco control came into picture and all. So tobacco control has been there for a long time. The early control, a few methods was like in 1624, the popes banned the use of tobacco, saying that it's not acceptable to use tobacco and all. So due to religious factors, a lot of people quit tobacco. In 1633, there's a report that from Turkey that said that there can be a death penalty given for smoking. And in 1794, the America introduced the tobacco tax for the first time. So there have been, even before people came to know or it was documented that tobacco is harmful, that is from say around 1900s. Even before that it was not documented, but tobacco was so harmful that people realized, and different people took different measures to try to control tobacco times. So around uh, we started seeing the WHO take a lot of interest in tobacco control. In 2002 2003 we had this WHO framework convention on tobacco control, and this is one of the documents which says that there's globalization of the tobacco so globalization of tobacco epidemic itself says that the tobacco pandemic has been there, and they realized that tobacco cannot be controlled by the national measures or by local authorities. They thought that the country should make strategies to control tobacco, because what happens is, suppose Pakistan is doing a lot of tobacco, Pakistan is producing a lot of tobacco and it is exporting to other countries, right? Or there is some illicit trade happening from Sri Lanka to India. So all these things were being considered, and they said that tobacco has to be and all the countries have to come together, uh, economics, in terms of agriculture, in terms of trade. So all these different departments of all the countries should make the different strategies to control tobacco. So from the public health point of view, FCTC and Empower are two WHO major interventions, or what they have done. So as we know, for COVID, WHO is doing a lot of things, vaccination, travel guidelines, right? Similarly, for tobacco, it has been doing its bit uh, s- uh, from a long time, but tobacco being a non-communicable disease is something which doesn't spread that fast, and the fatality also takes time. Within probably a month, it may lead to death, but tobacco 30 years for it to show the effect. So the priorities have been different, but WHO is doing its bit, and it follows what is known as an Empower strategy, right? So what is an Empower strategy? In Empower strategy, M is for to monitor tobacco use and prevention policies, right? So WHO monitors and does survey and finds out like what is the tobacco use in different parts of the world. and what is the government doing at in different countries to control tobacco. So what policies are in place, what policies WHO makes which each country can implement, or what local policies are being made to see tobacco, very major factor. The second is P. P means protect people from tobacco smoke. So what happens is, uh, uh, personally, if you ask me, if I am traveling or if somebody is sitting beside me and they are smoking, so that smoke, the second hand smoke, definitely is harmful for me. Okay, and many of us, like I many a time is very close to me and smoking, I sometimes get a headache just by the second hand smoke, and it has different manifestation. I have seen people who smoke so much that when they open their mouth to speak, you can feel the nicotine, and you can actually inhale that. People who are using tobacco, a lot of nicotine and other chemicals come out. And for us, like dentists, for us, if we are operating intraorally, definitely we will be wearing a mask, but still second hand smoke or this latent nicotine can cause a lot of problems. So you see, and especially for children, like parents, if they are smoking, we should inform pregnant females and children that the even if somebody in your family is smoking, you should try for second hand smoke. Third, offer help to quit tobacco use. And I think this is a very important point, tobacco cessation, right? So tobacco cessation is a subset of tobacco control. It's a part of control, but it is one of the important aspects. Okay, it's one of the important aspects. So what happens is, we know that this whole series of webinar ends towards how you can cancer at early stages. Okay, and then you quit tobacco. So because that is the ultimate aim, that's one of the very important things to be done. And very happy that India is doing very good with respect to tobacco cessation, and DCI has taken the initiative, and now every dental college has a tobacco cessation center. So definitely a lot is being done in this area, and a lot can be done in this area, which is tobacco cessation. Third is warn about the dangers of tobacco. So we know that long back the cigarette and everything was sold in a fancy packaging, but these days there are warnings on the cigarette packing that it is harmful, right? So all this, like it was only from the Empower strategy that a lot of policies were made and implemented in different countries. Next is enforce ban on tobacco advertising and promotion, right? So we know about a act known as Kotpa. Okay, but so that what happens is, initially we used to see that Wills is a company. Wills is a company which can which used to sponsor Indian cricket, or they used to all these international companies also used to sponsor fashion events or sports events, but all that has been banned. But only one issue which is still there, which is with us, is that surrogate advertising, right? uh, they advertise with the same name, but they call it like instead of gutka, they come up with pan masala with the same name. And people still feel that it is they say that it is pan masala, but actually people want, what they want is gutka of that same brand, right? So these are issues, and I think this also will be dealt with in the second lecture uh, in detail as to how these things happen. And R is for raise taxes on tobacco, and that we have seen from a long time that every budget the taxes on tobacco are being raised. So they are trying to make it more and more expensive, but still it's not still at times it's not as effective, right? So next, let us try to see the Indian epidemiology and how India is performing with the respect to tobacco use as well as to tobacco control. But very interesting piece from Reader's Digest is like there have been different various studies which are done and they predict the use and abuse of tobacco using different statistics. And what happens is there's always a tussle between the tobacco industry, which will show that no, tobacco is not harmful, whereas the other community, probably the medical community, which would show that the harmful effects of tobacco are there. So when we talk about Indian epidemiology, so we'll start with try to see how the situation of India is with respect to the world. So global tobacco surveillance system is a system which enhances country capacity to design, implement and evaluate, right? So this whole system of surveillance or the whole meaning of monitoring is because you need to know what is the problem, how much is the use, how much is the smokeless use, how much is the smoking. Then you need to design what are your action steps, what are the tobacco control interventions which you want to take, what policies you want to implement, and then to evaluate. So after you implement all these strategies, then you evaluate, has it caused some effect, did it lead to reduction in use, right? And then monitor the interventions with respect to the key articles, WHO's, FCTC, and components of Empower technical package, right? So all these things, like whatever policies you are making or whatever you are implementing, so all those, just to make it like we can compare it at a global level, we have these FCTC and Empower strategies just because we can compare things, interventions in different countries globally, and we'll have a common measuring scale as to what is doing who. Now the global surveillance system has the global youth tobacco survey, the global school personnel survey, the global health professions student survey, which is generally done on third students of medical, dental, Ayurveda, etc. And then we have the global adult tobacco survey, which is one of the most important. So these are the different types of surveillance which is done. It's done by WHO and in association with CDC Atlanta. So now coming to the Indian scenario. So in India, the Global Youth Tobacco Survey was first done in 2006, and it's a very extensive report. A lot of data is available in the public domain regarding this use. But then these are some of the important things, like 13.7% of students currently use any form of tobacco, 3.8% smoke cigarettes, and 11.9% currently use some other form of tobacco. And second-hand smoke exposure is high. That was calculated. This global youth tobacco survey was again repeated in 2009, and they found that in this 14.6 students use tobacco in any form, 4.4 use cigarettes, and 12.5 use other forms. So if you compare it with the previous data, in 3 years there was a increase in the use of tobacco by youth in India. That's from 2006 to 2009. Now you'll try to understand, as we said, that all these surveys are based these have started to happen after 2010 and till now. So considering what all steps India took for tobacco control, it's interesting to see that the global adult tobacco survey was held in India, organized in India from 2009 2010, And this was the state-wise use of tobacco use for those who are aged 12, 15 and above. So that's the adult population, how they are using. So more than 30% of the people using tobacco products in most of the states of India. Also, they give separate data on how the tobacco smoking was prevalent and how the smokeless tobacco use was prevalent in different states. So you see that Bihar, Jharkhand, Madhya Pradesh, Chhattisgarh, Odisha, these are the places where there's a lot of chewing tobacco which is used and smoking is less. Okay, so, and that's one of the main problems in India. A lot of people are using tobacco in chewing form. I think that also will be covered in one of the subsequent lectures as to how different things are being used. Now, again, the GATS-2 or the Global Adult Tobacco Survey was repeated in 2016-17. This was the data which we had, and before the COVID, we attended a few meetings, and here we saw that the prevalence of tobacco use in India, that's the yellow bar, came down to 28.6%. So there was a drop, but there's a huge disparity. So states like Goa, Pondicherry, Kerala, Punjab, Chandigarh, Himachal Pradesh, they have less people consuming tobacco in any form. But Tripura, Mizoram, Manipur, Assam, so the northeast areas, it's very high, the use of tobacco. And definitely, yes, the other states are more or less towards the center as compared to the national average. But then again, one thing to ponder about is what happens is Goa, if we talk about Goa or Punjab or Chandigarh, the other thing is Goa has a lot of access to alcohol. Okay, so alcohol, and so that may be one of the things that people resort to, alcohol over tobacco, and that's one of the things which they use to elevate their mood. And even if we talk about Punjab or Chandigarh, so we have come to know a lot, and movies like Urta Punjab and even the political rallies say that the consumption of narcotics is high in these states. So my only concern is that it should not be something like we are trying to control tobacco and give rise to the use of other products which may not be very helpful to us. So that is one concern, one of my concerns, which I feel should also be a thing to ponder over, right? So let us now it's about time to end. So let us just compare how things have been. So the yellow graphs are 2009-10 data, and the blue graphs are the 16-17. So that's mainly after the implementation of COTPA and other policies and acts that we have seen these changes. So tobacco users have come down, smokers have come down, smokeless tobacco users have come down, right? And that's the monitoring aspect of Empower. PEEP, prevention from second-hand smoke. So at home, it's come down. At workplace, it's nearly equal. Government, healthcare. At restaurants and public transport, it has definitely heavily come down, right? Yeah. So we see that now, if you see, definitely all the restaurants have smoking and non-smoking areas separate, and you can appreciate that the second-hand exposure at a restaurant has come down. Or even in the public transport, like now, they say that in a flight, smoking, including electronic cigarette, is banned, and even in train, it's not 100% implemented, but at least people, if you are traveling in an EC, though they will not smoke inside the coach. So all these things are being seen in Indian scenario, the data which is coming. Now, quit attempts there have been like in the adult like 15 to 24, the number of attempts to quit is less. But that again, I think things will change since we have a lot of tobacco cessation activities going on right now. Noticed health warning labels on packages of cigarettes, BD, and smokeless tobacco. So cigarette, definitely it's a huge rise. Even BD, which was previously there was initially no, it was just written that smoking may cause cancer, but now with the pictorial warning and all, people actually look at it. They actually look at it and they reported that yes, we have seen these warnings. Next is empower. So notice any type of cigarette, BD, or smokeless tobacco promotion, right? So all these promotions have come down. Cigarette advertisements, BD, and smokeless advertisements have come down. Now, average monthly expenditure on cigarette and BD, it has definitely gone up. So now my concern is that although the prevalence of tobacco use came down a bit, but the monthly expenditure increased, and this has been compensated for the inflation, right? This is compensated for the inflation. So this is one of the things which shows that government is increasing taxes on tobacco product. The tobacco products are becoming more and more expensive, and so but still people are willing to pay a lot more than what they used to pay earlier. So economics in tobacco control is very important. In the initial stages here, when we do tobacco cessation, we do make it a point to note as to how much the person is spending on tobacco per month. So, and how that money could have been diverted and used for some other things for his family. So these are the different aspects. Now we see that the future is bright and full of opportunities. One thing is, yes, the Indian epidemiology, if you see the government, the policies, the implementation, everything is there, and tobacco consumption has come down. So the future is bright at a national level. And it is full of opportunities for you as interns and as students of a dental college, and especially with the lineup of different speakers and the different topics which are coming over the next 10 days. You will be learning the different aspects of tobacco cessation and tobacco control, and you will definitely find some place and take your career further. I hope all of you take this seriously and take active participation in tobacco cessation. And what they say is that every dentist, whenever you are examining somebody, so you should spend some time and do a very brief intervention, because any changes in the oral cavity it will be first visible to a dentist, and he is the person who can diagnose any changes at the earliest stage, and that can have a huge impact in the patient's life, right? So the earlier it is diagnosed, it can be less expensive to treat, or it can save the life of the person, or it can increase the number of years which a person would live after the surgery or treatment, whatever. So the earlier the better, and we have the opportunity to change a lot of lives. So with that, I end my presentation, and I think it's just about time.
Thank you so much, sir, for the illuminating talk. Now I request Dr. Siddharth Kumar Singh, sir, to kindly conduct the question and answer session for the day. Over to you, sir.
Thank you, Dr. Bhavya. And it was really a very informative session, sir. So now I'll be taking up with the questions. The first question is there any change in the trend of tobacco consumption post-COVID-19 pandemic?
Yes, and sorry that I had to rush through the slides because there was a lot of content, and I tried to give you an overview of a lot of things. Yes, COVID-19 and tobacco, there are different aspects to it. There have been reports on how smoking was detrimental to recovery from COVID, and those who were smokers had a means I'm talking about COVID-19 and smoking. So one of the concerns was that those who got COVID and those who were smokers, there were reports that they did not do as well as those who were non-smokers. Second factor was, yes, when we had the lockdown, the availability of cigarettes was one of the concerns. But then, and then that since the cigarette was not available, a lot of things happened with respect to tobacco cessation. So a lot of tobacco cessations were active and they were getting phone calls and they were helping people quit. But then there was another large part of the population which because they were getting other supplies, so somehow they were even getting supplies of tobacco products somehow. So although COVID-19, if you talk, it was good opportunity for tobacco control and tobacco cessation, but and it was actually not a very good time for those who were having withdrawal symptoms and they were not able to quit. But then I think definitely we can report that there was some decrease in consumption. But then definitely different states, a lot of states had very strict lockdown, but a lot of other states the lockdown was not as strict. So I guess the availability was there.
Okay. So next question is there something known as good quality tobacco?
I don't know of anything which is known as good quality tobacco. I am not sure if there's anything as good quality tobacco. And most of the things which have come recently which say that this may not cause cancer and this will just elevate the mood. So of late all those products have been banned or they have shown to be have the same effect. So I don't see any product which can be which we can recommend.
Right, sir. Okay, next question is Indian economy is being supported by tobacco selling. So is there upgrade in its cultivation technique also?
Yes, see, one of the things which the WHO has not considered in the Empower strategy is the agricultural aspect of tobacco. So what happens is tobacco is a cash crop. So when we think about tobacco control outside the Empower or FCTC, there are few other things which we should also think of. Suppose there is a farmer who's growing tobacco and is earning a lot of money through it. So we have to give him an alternative crop. And one of the books publications of WHO, it says that if tobacco is grown in a particular farm, that farm generally does not yield any other crop well. So that has to be considered. Secondly, yes, government is raising a lot of taxes on tobacco. So definitely it's adding to the economy in a way, but definitely I don't think the government is the purpose is not to increase the income of the government through raising taxes, but to control tobacco using that. And then the third aspect is also we have a few publications on how tobacco is being sold and tax is being evaded a lot, because frankly we also go to some PHCs and in the villages. So what we many times see is that the tobacco is grown and it's sold at the local hut. So all that sale which doesn't come through the government channel or which is not recorded, the taxes are evaded in that. So you cannot control that type of sale and use of tobacco.
Right, sir. Okay, the last question is, sir, what is synthetic tobacco?
Synthetic tobacco, I am not very sure as to what it is. Probably it's chemically produced nicotine in the lab. I think they have found some chemical way in which they can produce this, and I think all these synthetic tobaccos are being used a lot in your smokeless ends devices and all. So
Yeah,
I
that's right.
think it's that tobacco which has come from not from the plant but from a lab. So that may be pure chemical. So it's probably something related to a lot was going on even with the meat, that they said that you need not kill animals for meat, but grow the meat in a lab culture and all that. So I think that's about synthetic tobacco.
Fine. So thanks a lot for clearing the doubts. Over to you, Bhavya.
Thank you, Dr. Praneeth Gupta sir, for clarifying all the doubts. Thank you, Dr. Siddharth sir, for conveying all the questions and queries to our guest speaker. Now, I request Dr. Sunira Chandra ma'am to express her views on the lecture. Over to you, ma'am.
Thank you, Bhavya. Congratulations, Dr. Puneet. I guess this series of lectures has commenced at a very good note. You have made these statistics look so simple now. And it is it was very, very simply and straightforwardly you have put everything. And I would say that it must be really understandable for all the interns here. And that is the idea of these lecture series. As you have just put on this template also on the last slide, so they can go through all the topics that we have planned for this lecture series. And your lecture had to be the first lecture so that they should get the overview. And I think they have probably got the clear picture of what tobacco is and from where it has originated. And I would also like to mention, very rightly, you have said that, government is increasing the taxes and manufacturers are increasing their price. So both the parties are having a good time. It is only the consumers who are becoming sandwiched between the manufacturers and the government policies and everything. So I think the dentist, the young mind out here, should take this as an opportunity that they have a lot to do in the field of dentistry and make tobacco control and cessation a very integral part of their dentistry and make it a part of general dentistry. So that is why we are here with this add-on program. Thank you so much, Dr. Puneet, and congratulations again.
Thanks a lot. I hope I gave an overview and that would lead to the other lectures. And yes, I would also be attending the other lectures. And I hope your interns will take things further from here.
Thank you, Dr. Sunira ma'am, for expressing your views. Now, I would like to humbly request Dr. K. Dubis, sir, Principal, Professor of Department of Oral Surgery, Saraswati Dental College, to share his views for the ongoing session. Over to you, sir.
Yeah, thank you so much. Dr. Puneet, I'm really impressed the way you delivered your lecture today. And I'm very much impressed with the line that the future is bright and full of opportunities. And it is very, very true. Because the data and the statistics which you provided in your presentation really reflected this concept. I could see that as you showed that the publicity expenses for consumption of tobacco, prevalence, and all those things are coming down. Only the up is the expenditure which is being paid by the consumers in the consumption of tobacco, and that is a good sign because the expenditure is going. So gradually, the people who cannot afford it will, certainly try to leave these habits, and that will be the actual, the victory of the community who is after the tobacco, control. Like we are those people. So the data and different aspects of tobacco pandemic which you presented were really very good. And I really appreciate your lecture and the historical perspectives and the perspective of Indian epidemiology in this. So all those things were very nicely covered. And I'm sure this series of talks, there are six lectures in this series, and the start is excellent, and all the lectures will be good. Our students, postgraduate students, interns, and the faculty will certainly get a lot of information and will be benefited by the knowledge which will be shared in this during all these 6 days. So I thank the organizers for this, Dr. Sunira and her team, for conceiving this idea and putting it actually on the go. So thank you very much. I will now
you, sir.
ask. Yeah, I will just a certificate of appreciation. Kindly, please, just flash the certificate.
Yes, sir. Yes, sir.
Thank you, sir, for the kind words, and thank you all the participants for staying and listening. And it was a good interactive session. I hope I met the purpose.
Yeah, sure, Dr. Puneet. So, Dr. Puneet, kindly accept this certificate of appreciation for your excellent deliberation on
Thank you.
this tobacco control cessation programs. So,
Thank you.
thank you so much.
Thank you, everybody. Thank you, the entire team of Saraswati Dental College, Lucknow. It was my pleasure to deliver this webinar for you.
Yeah, thank you. Most welcome. So, over to you.
Thank you, Principal Sir. Thank you for your views and presenting the certificate. Now, I call upon Dr. Mahend Kumar Singh Sir, Lecturer of Department of Oral Medicine and Radiology, for delivering the vote of thanks. Over to you, sir.
Thank you, Bhavya. A graceful and warm afternoon to everyone present. On behalf of Department of Oral Medicine and Radiology, Saraswati Dental College, Lucknow, I deem it a great honor and privilege to propose the vote of thanks to all the dignitaries present here. Let me first of all start by giving glory to the Almighty God for making this event a resounding success. I thank our speaker for today's program, Dr. Puneet Gupta Sir, for his effective and informative lecture, which I am sure is a significant add-on to everyone's knowledge. I would like to address my heartfelt thanks to Mrs. Madhu Mathur Ma'am, Chairperson, Saraswati Group of Institution, Dr. Rajat Mathur Sir, President, Saraswati Group of Institutions, Mr. Charit Mathur Sir, Director of Finance, Saraswati Group of Institutions, Mrs. Smita Mathur Ma'am, Director SHRC and BSM Nursing, Mrs. Ritu Mathur Ma'am, Director HRD and Marketing, Saraswati Group of Institutions, for being the catalyst that stands as a pillar of power and inspires us to do our best. Without their encouragement and cooperation, this event would not have been possible. I would like to express my deep gratitude to our principal, Dr. K.N. Dubis Sir. His able guidance and commitment has always encouraged us to achieve higher academic excellence. I express my thanks to all the heads of department, faculty members, departmental alumni, postgraduates, interns, and undergraduate dental students for their active participation and patient listening. We have been fortunate enough to be supported by a team of very motivated and dedicated departmental colleagues who know their jobs and are result-oriented. Thanks to all of them. I would like to acknowledge the efforts of technical and non-teaching staff who have worked hard to ensure this occasion becomes a success. It requires a planning and a bird's eye for details. I would like to express my heartfelt thanks to Professor Dr. Sunira Chandra Ma'am, Head Department of Oral Medicine and Radiology, for supporting and motivating us in organizing this program. Finally, I would like to end my speech with the inspiring quote of Martin Luther King. A thankful heart is not only the greatest virtue, but the parent of all other virtues. Once again, thank you all for your patient learning. Thank you. Over to you, Bhavya.
Thank you so much, Dr. Mahend Sir, for presenting the vote of thanks. Lastly, I want to express my heartfelt gratitude to everyone who took out their time to present here for the program. It was a successful session. Our next session will be on 17th of February from 2 p.m. to 3 p.m. on National Tobacco Control Strategy and Legislations. Looking forward to see you all on 17th. Once again, thank you so much for your valuable time and presence. And